counting the costs. U.S. hospitals feeling the pain of physician burnout. Ann Arbor, Michigan. Reuters, Dr. Brian Halloran, a vascular surgeon at St. Joseph Mercy Ann Arbor, starts planning his garden long before spring arrives in southeast Michigan. His tiny plot, located in the shadow of the 537-bed teaching hospital, helps Halloran cope with burnout from long hours and the stress of surgery on gravely ill patients. "You really have to find the balance, to put it a little more in perspective," he said. Hospitals such as St. Joseph Mercy Ann Arbor have been investing in programs ranging from yoga classes to personal coaches designed to help doctors become more resilient. But national burnout rates keep rising, with up to 54% of doctors affected. Some leading healthcare executives now say the way medicine is practiced in the United States is to blame, fueled in part by growing clerical demands that have doctors spending 2 hours on the computer for every 1 hour they spend seeing patients. What's more, burnout is not just bad for doctors, it's bad for patients and bad for business, according to interviews with more than 20 healthcare executives, doctors and burnout experts. "This really isn't just about exercise and getting enough sleep and having a life outside the hospital," said Dr. Tate Schoenfeld, a former Mayo Clinic researcher who became Stanford Medicine's first chief physician wellness officer in September. "It has at least as much or more to do with the environment in which these folks are practicing," he said. Schoenfeld and other researchers have shown that burnout erodes job performance, increases medical errors and leads doctors to leave a profession they once loved. For a graphic, click tmsnrt.rs. My hospitals can ill afford these added expenses in an era of tight margins, costly nursing shortages and uncertainty over the fate of the Affordable Care Act, which has put capital projects and payment reform efforts on hold. Burnout decreases productivity and increases errors. "It's a big deal," said Cleveland Clinic Chief Executive Drive. Toby Cosgrove, one of 10 U.S. healthcare CEOs who earlier this year declared physician burnout a public health crisis. Hospitals are just beginning to recognize the toll of burnout on their operations. Experts estimate, for example, that it can cost more than $1 million to recruit and train a replacement for a doctor who leaves because of burnout. But no broad calculation of burnout costs exists, Schoenfeld said. Stanford, Harvard Business School, Mayo and the American Medical Association are working on that. They have put together a comprehensive estimate of the costs of burnout at the organizational and societal level, which has been submitted to a journal for review. In July, the National Academy of Medicine, NAM, called on researchers to identify interventions that ease burnout. Meanwhile, some hospitals and health insurers are already trying to lighten the load. Cleveland Clinic last year increased the number of nurse practitioners and other highly trained providers by 25% to 1,600 to handle more routine tasks for its 3,600 physicians. It hired 8 pharmacists to help with prescription refills. Atrius Health, Massachusetts's largest independent physicians group, is diverting unnecessary email traffic away from doctors to other staffers and simplifying medical records, aiming to cut 1.5 million mouse clicks per year. Insurer United Health Group, which operates physician practices for more than 20,000 doctors through its Optum subsidiary, launched a program to help doctors quickly determine whether drugs are covered by a patient's insurance plan during the patient visit. It is also running a pilot program for Medicare plans in 8 states to shrink the number of procedures that require prior authorization. Similarly, Aetna Incorporated this year began a behavioral health program that eliminates prior authorization requirements for admission to some high-performing hospitals. Experts define burnout as a syndrome marked by emotional exhaustion, cynicism and decreased effectiveness. Many burned-out doctors cut back their hours to cope, and a disturbing number commit suicide. A landmark 2015 Mayo Clinic study found that more than 7% of nearly 7,000 doctors had considered suicide within the prior 12 months, compared with 4% of other workers. About 400 a year go through with it. Driving the burnout symptoms is the burden of data entry on clumsy electronic medical record systems that doctors must use to prove the quality of their care, said Dr. Christine Sinsky, Vice President of Professional Satisfaction at the American Medical Association. Sinsky recently conducted an experiment in her own internal medicine practice in Dubuque, Iowa. She asked a staff member how many mouse clicks it takes to order and record a